Hello and welcome to another edition of the China in Africa podcast. I'm Eric Olander, and as always, I'm joined by Cobus Van Staden of Wits University in Johannesburg, South Africa. A very good afternoon to you, Cobus.
Good afternoon.
Cobus, today we're going to be talking about malaria, and it's really the first time in a long time that you and I have discussed medical issues. And I think the last time we talked about this was during the 2014-2015 Ebola crisis, where, of course, China played a very important role in West Africa in combating and kind of rolling back the crisis from the brink that it really brought much of Liberia and Western Africa to. But yet, you know, behind all of the HIV and the Ebolas that capture all the headlines is malaria. And malaria is really one of the most pressing public health challenges in Africa, but even around the world. It kills at the same levels as diabetes, HIV, and it's even ahead of lung cancer. But yet it doesn't get the same types of headlines that those other diseases do. And then, well, here's an amazing statistic, Cobus. 90% of malaria deaths occur in sub-Saharan Africa. And this is the tragic part, is that the vast majority of the victims are children under 5. So it's costing about 400,000 African lives a year. Somewhere in the range of $12 billion a year is lost in productivity and opportunity, according to the World Bank. So let's kind of talk about what is being done. The Chinese now are starting to step into the malaria space. And remember, as a developing country, they have quite a bit of experience in dealing with these infectious diseases and these kind of mosquito-borne diseases. Big parts of southern China are, in fact, tropical. So it actually makes sense that the Chinese would bring a lot of their know-how and their expertise to Africa in fighting diseases like malaria. The data that we're looking at is about $124 million is spent by the Chinese in anti-malaria assistance. Just to give you some context, that's dwarfed by what the United States is going to spend just this year in fighting malaria, somewhere around $750 million in 2017. So, Cobus, the Chinese are spending over $100 million. The Americans are spending somewhere close to $1 billion. So I guess the question is, why aren't these two actually working together if they are fighting the same battle?
That is a big question. Malaria is frequently seen as an area of potential cooperation between the US and China in Africa. I think, among other reasons, because it is a big pressing health concern. You mentioned how many people die of malaria. That is already a massive tragedy. The second tragedy around malaria is the fact that a lot of Africans have long-term repeated bouts of malaria, and frequently, you have situations where people are very weakened by repeated bouts of malaria. So malaria has a direct developmental kind of impact in Africa. It's not only the tragedy of the deaths, of course, but then the additional kind of developmental lag that it brings in economically in Africa. And it's also it's a great space for collaboration, potentially because it carries less kind of political baggage than something like HIV does. Kind of where different forms of treatment and kind of issues around sexuality and so on complicate the treatment picture in Africa significantly. So on paper, it seems like a perfect space for collaboration.
Okay, so there's some new ideas that are now starting to float around about how the United States and China can work together. Now, remember, the United States and China do not do much in Africa together. And in many places, they're bumping up against one another, particularly in places like South Sudan, where both are actively involved in the peace process there, and, of course, during the Ebola crisis. But some ideas now are circulating about how malaria might be the area that the United States and China collaborate. A new paper just came out or is about to come out, in fact, how China and the United States can collaborate with Africa to eradicate malaria. The two authors, Dr. Yawei Liu, is the director of the China program at the Carter Center in Atlanta, Georgia. And William Pierce is the proud owner of a freshly minted master's in public health degree from Emory University at the Rollins School of Public Health, also in Atlanta. And he's also the China program's graduate assistantship. So both Yawei and Bill, welcome to the program.
Thank you. Thank you very much.
We're the first time the Carter Center is on the show. Really very, very honored to have you guys with us. Let's get right to the basic question. It's the question that I posed to Cobus. Okay, the United States is spending a lot of money fighting malaria. The Chinese are spending a lot of money fighting malaria. Yahweh, tell me, why isn't it that these two are actually working more closely together?
Well, they're not working closely together because I think what is missing is, a few weeks ago, we were in Washington, and Kurt Campbell, the former Assistant Secretary in charge of Asia and the Pacific, said, there is no habit of collaboration between U.S. and China anywhere in the world. And of course, Africa is one area. You mentioned earlier that China and the United States did work together in South Sudan, waging peace there, and working together on fighting Ebola is another example. And I think other than these two, William and I have been working very hard for the past several months to look for where else collaboration has taken place. I mean, they're just missing. And we think malaria probably is a good area. I guess the key thing here is, there is suspicion toward each other by the Chinese against Americans, Americans against Chinese, because Americans are accusing Chinese of extracting everything good from Africa. I think the Chinese are basically criticizing the Americans that they're doing everything to export so-called Western values. So they don't have confidence in each other.
William, I wonder if you could tell us a little bit about how the American and Chinese approaches to treating malaria on the ground. How are they similar and how are they different? Are they essentially doing the same thing or overlapping things, or is there a kind of a natural space for them where they can easily collaborate?
Yes, I think that's a great question. And what we're finding is both the United States and China have these multi-pronged responses to malaria in sub-Saharan Africa with many complementary elements as well as many elements that directly overlap. So the Chinese, for example, are constructing a lot of healthcare facilities. This includes 30 hospitals and 30 anti-malaria centers across Africa. These anti-malaria centers provide basic outpatient care for Africans. The Chinese have also sent Chinese medical teams throughout Africa since 1963, which provide free care in often rural or resource-limited settings. And they also provide training both in China and in Africa to African healthcare workers. The provision of medical equipment, including microscopes and anti-malaria drugs, is also relatively commonplace in the Chinese Global Health Assistance Program. The United States, on the other hand, has a much more broad approach. You may be familiar with the President's Malaria Initiative. This interagency initiative includes is led by USAID and is implemented with the Centers for Disease Control and Prevention as well as the Health and Human Service. And this has technical and cross-cutting areas. So we see within the President's Malaria Initiative those complementary elements such as bed net distributions. Obviously, this is a very common preventative measure. You provide individuals in sub-Saharan Africa with bed nets. They sleep under them. They're not bitten by the mosquito, and then malaria cannot be transmitted to them. And then, again, we see that direct overlap with the provision of medical equipment and also the training of Africans in a much similar fashion to the Chinese.
Okay, so you brought up the president, and so I'm going to, that's the proverbial elephant in the room here, is Donald Trump. And you, in your paper, and this was kind of what I was a little bit perplexed by, there were two key pieces of information to me that were missing in the paper. Donald Trump has made it abundantly clear that Africa is not a priority for him. In fact, he's made it very clear that foreign assistance is not a priority for him, and he's made it clear that they're going to cut the aid budget. So whatever the president is doing now, probably a year from now, is going to be a lot less. The second thing that was missing from the paper, in my opinion, was What's the incentive for these two to work together? I don't get what they benefit. I was trying to understand, like, why would the Chinese want to work with the Americans? The USAID system is a complicated, bureaucratic, bloated system that is incredibly difficult to navigate. Why, in any reason, would the Chinese want to somehow tie up their aid system into a system that's not complementary at all with theirs? I'd like to get both of your responses to those two questions. So, Dr. Yao, Dr. Liu, again, the Trump question, we have to talk about it because it's a reality that confronts anything that involves spending lots of money in Africa, which is not a priority for this administration. And also, what's the incentive for these two governments to actually work together when they themselves don't see anything?
Yeah, President Trump was elected on the pledge that America first, that the United States should reduce foreign aid and should reduce its engagement globally. And I think it's on that pledge he was elected. I think there is a sense of tiredness. There is a sense of, what about our crumbling infrastructure? What about our crumbling schools? Taxpayers' money should be spent more here at home. But we actually looked at the budget that was recently approved by Congress. Most of the health initiatives in Africa and other developing countries are being preserved. So here is the deal, is that, President Trump has his own preferences, but there's also Congress that he will have to overcome. And so far, he has not been able to do that.
The president, I'm sorry to interrupt you, but the president sets the agenda, and his heart isn't in this. The State Department's heart is not in this. So maybe this year's budget got through because, frankly, it's their first year in office. This is a very chaotic administration. But you got to think over the next 2, 3, 4 years, they're going to figure out how to cut the budget. So you got a reprieve for a year, but maybe next year it won't be that way. Exactly.
I think that's sad, and that's unfortunate if that is the case. But that also provides an opening for a more assertive China sort of to take the vacancy. What we heard is that even during the Mar-a-Lago meeting, President Xi Jinping of China expressed the interest of China contributing the PEPFAR initiative if U.S. is going to cut the budget. So that basically takes us to the second question is what does both countries get from collaborating in Africa? I think the United States and China both realize the African continent is important, not only for its own sake, but also for the future of peace and harmony of the world. And there's also a radicalization of the population angle here that both countries are quite aware. So for both countries, Africa is very important, not just to sustain peace, but also to sustain development, so that that continent can become, oftentimes people say, the land of hope, the land of future prosperity. I mean, just to be cynical, Africa is very important, both to China and the United States, as a potential huge market for products and services from both countries. So that premise is there. Both countries, they're not going to, quote unquote, abandon this continent. So they all have their own resources and investment. So the unfortunate fact that we're confronting, and it's also our goal to try to reduce that, is for the two countries to share the information and, if possible, to discuss how they're going to coordinate and collaborate so that they could create synergy when they provide developmental assistance, including public health assistance.
Yeah, I would just quickly add, you're absolutely correct, and there's been some alarming cuts proposed, but based upon our research, it seems that vaccine efforts such as the Gavi Alliance, and then, like Dr. Liu mentioned, PEPFAR, and the President's Malaria Initiative have been spared. So within the foreign assistance programs or foreign assistance world, those are few winners in a sea of losers. I would just highlight what, when it comes to China and the United States collaborating when it comes to malaria assistance, I think the overall health assistance programs that each country provides can be enhanced. So one interesting thing that we found is there's been almost a similar mentality in China that as China develops, as the Chinese themselves require and demand a better standard of healthcare, there is a level of skepticism in terms of the resources that are being sent to sub-Saharan Africa. And one thing that the Chinese program can improve upon is a stronger monitoring and evaluation scheme, which is part of the president's malaria initiative. So getting those numbers to justify the cost can produce stronger health outcomes. I would also say that the Chinese have done some really innovative work in malaria control, for example, in the Comoros Islands, where they actually addressed malaria by looking at infected individuals, not looking at combating the mosquito vector, which is almost ubiquitous across other malaria programs. So having that information on cost efficiency and the possible ability to scale up those programs is another advantage we feel Chinese-American dialogue in the health area could bring benefit to all players, both the Africans who are going to have better health outcomes, and both the Chinese and the Americans who are going to be able to enhance their own public health outreach programs.
But Bill, on that point, you also mentioned in the paper that on the surface, one would assume, that African governments would be all on board because, malaria is a massively destructive and expensive problem for them. But you also mentioned in the paper that there are actually some misgivings among African government officials about US-Chinese collaboration in this effort. I wonder if you could unpack their attitude to this collaboration a little bit more.
So the China program focused on promoting collaboration between U.S. and China in Africa. And we're aware constantly the challenge is that on the African side, there is the concern, there is a fear of a G2, a sort of solution to African problems or difficulties and issues. So during our past meetings, we've been talking about this. We've been inviting Africans, and the Chinese approach on the foreign aid issue is always everything has to be proposed by Africans, approved by Africans, and led by Africans. And this is what is missing. I think another obstacle for future U.S.-China collaboration on this is until and unless Africans are going to take the lead saying, we want you countries to work together with us to, for example, reduce or eventually eliminate malaria. That collaboration probably won't happen. I mean, just on their own of their own volition, maybe the Americans and the Chinese can share best practices, but on the ground, they probably, if Africans are not inviting, they're probably going to do it themselves. So the African CDC. We're optimistic is that the African CDC is the single most important example or instance of Africans asking China, United States, and other donors to work together to establish this. So we're hopeful that this instance is going to be extended to other areas of developmental assistance. I mean, there's only so much from each country to be contributed to Africa. If there is no coordination and share of information, I think a lot of the resources probably get squandered. They could be put to best use if there is at least share of information.
Yeah, I would just add that we are starting to see a change in mentality or a shift in mentality. Chinese-American collaboration has been praised by the Liberian president, Ellen Johnson Sirleaf, and the Tanzanian president has welcomed China into the Tanzanian multi-donor anti-malaria program. So while there is obstacles to this, we are starting to see a shift in mentality and more opportunities for this novel collaboration.
Cobus, where I can see some potential is on the multilateral side of things. So through the United Nations, through ECOWAS, through the African Union, where we've talked in a number of different shows, and of course with the head of the UN in China, who talked about how the Beijing is embracing these multilateral organizations much more than they did 10 years ago. I will have to say, though, that I'm very skeptical that the United States and China have a lot of potential to work together, and in part because there's no natural constituency that is pushing it from either side. In fact, I would say that populations on both sides of the Pacific are increasingly populist, nationalistic, skeptical of the others. We've seen public surveys now in China about a growing level of cynicism towards the United States, and certainly Donald Trump over the course of the campaign kind of fueled this perception that China is America's enemy. So again, I don't see any natural constituency that would want to be promoting this. And more importantly, the Chinese don't feel welcome in the Western aid system. I mean, after all, they were so frustrated with what was going on in Washington with the World Bank that they set up their own World Bank through the AIIB, the Asian Infrastructure Investment Bank. And they're setting up parallel systems with the BRICS Bank and whatnot outside of the Western aid system. So it seems very, very kind of a big jump for me to see that they would then want to jump into it. Cobus, what's your final thoughts on this?
Okay, I'll take a slightly different tack. I think maybe healthcare offers the perfect space for collaboration, kind of with the proviso that there obviously needs to be political will. And I think I agree with you that at the moment, political will seems to be lacking, especially on the American side, right? I mean, not in the whole of the American side, but particularly within the White House at the moment. However, as you say, multilateralism, China's very pro-multilateral cooperation. So I think there is a glimmer of a chance. I would also say that kind of this kind of collaboration, Africa offers a great opportunity for this kind of collaboration. And I mean, if it were possible for the US and Chinese militaries to work together, for example, in anti-piracy operations off the coast of Somalia, then comparatively shared healthcare is actually less controversial, less kind of potentially dangerous than that kind of collaboration. So I think kind of I from an African perspective, I want to be optimistic because malaria is a massive problem in Africa and it's a systemic problem that is just not going to go away, and it's going to take a lot of money to fix that. So I would agree with Yahweh and William that the best the best application of these resources would be optimum. But I share your doubts in terms of whether the political will is really there at the moment.
Okay, Yahweh, Bill, let's get your final thoughts. Where are we going to be 5 years from now? Yahweh, are we going to see Sino-American, anti-malarial programs in Africa, or is this just something that's going to take a lot longer, in your opinion?
I think, what you mentioned earlier about the structural as well as fundamental issues that hinders U.S.-China collaboration. I think we probably are seeing, if not a sea change, but some change of substance from both sides in terms of how one side is looking at the other. Since the meeting in Mar-a-Lago, the relationship between Washington and Beijing has become much closer. This is largely because of the crisis in the Korean Peninsula. I think Secretary of State Tillerson also has heartened the Chinese when he said United States will stop promoting Western values in its foreign policy. We're going to focus more on result-oriented approaches. And the Chinese like that. I think the China side has gradually realized probably this is going to be a slow process, that there is no conspiracy on the side of Washington that everyone from Pentagon, from Foggy Bottom, and the White House, want to undermine the rights of China. So in 5 years, I'm glad the Gulf of Aden anti-piracy initiative was mentioned, because we've been working on anti-piracy among Chinese and Americans as well as Western Africans in the Gulf of Guinea. So I'm very hopeful, and we recently had a workshop in China on how to bring U.S. and China closer on health engagement. So I with podcasts like yours and support from USIP and SIA, as long as we keep working on this to promote this collaboration and sharing of information in 3 to 5 years, I think the African CDC is also going to take off. That will open a much larger vista for the three stakeholders: African countries, the United States, and China, to work much closer.
Yeah, I think with the tremendous success that the Chinese and Americans have had in working with African partners in addressing Ebola, and now with the African CDC, these instances of successful collaboration are going to become more apparent and more visible. I'm optimistic that with these realities and with stronger health outcomes and with a more financially frugal utilization of resources, more and more leaders and individuals are going to get behind collaborative efforts and see the value in them. I can't tell you if malaria is going to be that in 5 years, but I do think that there are some very compelling arguments for stronger coordination that is to everyone's benefit.
Bill Pierce and Dr. Yawei Liu are the authors of an upcoming article, How China and the United States Can Collaborate with Africa to Eradicate Malaria. Both Yawei and Bill are with the Carter Center in Atlanta, Georgia. And thank you, both of you, for coming on the show and for being far more optimistic about the future than I am.
Thank you.
Thank you. It's my pleasure.
We count on you to be more optimistic than me. Cobus, it's good that we're ending on a positive note. So I'm happy that it's not always a downer when on these kinds of things. So we'd like to see more U.S.-China cooperation. It's something that everybody dreams about. We haven't seen it yet. But again, with these ideas that are being put out by Yawei and Bill, and also Saya, and what we're doing, we hope, again, that we can continue the discussion. If you would like to join the conversation, of course, all the different ways are available to you: LinkedIn, Facebook, Twitter, email. We have an email newsletter that goes out every Monday. Go to our website at ChinaAfricaProject.com and you can sign up. You'll get the top China-Africa stories delivered to your inbox every Monday morning, East Coast time. Cobus and I put that together, and we put papers in hopefully when this is published, we'll share Bill and Yawei's paper with everybody. So until next week, we'll be back again with another edition of the China in Africa podcast. For Cobus Van Staden, I'm Eric Olander. Thank you so much for listening.